Welcome, everyone. Thank you for tuning in to our presentation today. Today, our topic is wellness in the time of COVID-19, and this is hosted in partnership from Alzheimer's Orange County. My name is Melissa Klabe. I'm the Director of Education for Alzheimer's Orange County, and today we have the pleasure of our presentation being given by V. Lay. She's the Community Health Educator from the Office of Community Outreach and Education at the UCI Chao Family Comprehensive Cancer Center. And so I will turn it over. Thank you.
Hi, Melissa, and hi, everyone. Thank you so much for giving me the opportunity to present these resources to Alzheimer's OC and the community. And so today's presentation is going to be talking about wellness in the time of COVID-19. And so as we all know, with the COVID cases, it's like surging, as well as the county coming back to purple tier, and then the holiday season coming up as well, I think it is important to make sure that we stay up to date with COVID-19 resources. And so in this presentation, you will learn how to protect yourself and others, how to manage and cope with stress, and then what to do if you have COVID-19, and then testing information and community resources in Orange County. So I'm going to go over a little bit briefly about what is COVID-19. And so, COVID-19 is a new disease caused by a new coronavirus that has not been previously seen in humans. There's many types of human coronaviruses. This one is not the same as, the coronaviruses that causes the flu or the cold. And it spreads mainly through person to person through respiratory droplets produced when an affected person coughs, sneezes, or talks. And COVID-19, has seemed to be half community spread. And community spread means people who have been infected with the virus in an area, including some who are not sure how or where they became infected. And so all in all, COVID-19 is very easily spread, as we all know. And so the next question is, well, how can I protect myself and others? So the CDC recommends following these guidelines on how to protect yourself and others in terms of prevention. And so knowing how to protect ourselves and others can give us a peace of mind. And so I'll be covering, like these 4 topics, which is sanitation, social distancing, face mask, and then how to monitor your health and what you should do if you are infected with COVID-19. So with sanitation, right, I feel like all of us have been washing our hands for as long as we can remember. But even now, it is even more important to stay on top of washing your hands and making sure that you do wash your hands with at least 20 seconds and with soap, especially after coughing, sneezing, when caring for the sick, right, caregivers, before, during, after you prepare food, before eating, after using the toilet, when hands are visibly dirty. And then, sanitize and disinfect frequently touched surfaces. So, the fridge, the door, your tables, your phone, especially, because we use that every day. So remember to, disinfect and sanitize those objects very frequently. And then if you're outside running errands, going to the market, picking up food, and you don't have access to use the restroom and wash your hands with soap, it is recommended that you, use hand sanitizer with at least 60% alcohol if possible. And then I love, so I just love like infographic. I think they're just easy to understand, and I just love pictures in general. So this is an infographic that shows you the right way to wash your hands so that you can effectively and properly protect yourself and others. And so I just use this, to show folks, this is how you wash your hands. So I think this is really useful, and make sure again that you wash it for at least 20 seconds and with soap. And then social distancing. So we've heard a lot about social distancing, that we need to social distance when we're outside, but what does it really mean and how to properly do it? Social distancing means keeping a safe space between yourself and other people who are not from your household. So if you go out to run errands, go to the market, pick up food, it is important that you practice social distancing in order to protect yourself and others. And that means, staying 6 feet, about 2 arms length from people outside of your household. And this should be practiced in combination with other preventative measures, such as washing hands, like I mentioned earlier, and home isolation and sanitizing services. So you can't just go out and, social distance without wearing a mask, right? It doesn't really work effectively like that. And then also, if you are going to gatherings, right, with the holidays coming up, visiting your parents, visiting loved ones, and hanging out with people who are not in the same household, practice social distancing is really important. And again, it is recommended that you limit going out unless it is essential. But if you do go out, it's important to understand that the potential risk of going out. So questions to think about and keep in mind would be, is COVID-19 spreading in your community? Will you have potential close contact with someone who is sick or someone who is not wearing a face mask? Or are you at an increased risk of illness, and will you have close contact with someone who is more at risk, especially if you're a caregiver? So always important to consider the risk that personally affects you and the folks in your community. But if you do need to go out, again, practice social distancing is essential. And so I want to talk more about multi-generational households. So if you live in a household where it's crowded, right? You live with your parents-in-law, you live with your mom, your dad, your uncle, aunt, cousins, because a lot of our communities, especially our immigrant communities, we live in, multi-generational households. So how do we practice social distancing, and how do we practice safe protocol when living with a lot of people at the same time? And so these are the tips that CDC recommends, right? Is for us to limit to only essential errands. So if we have to go out, limit it to only grocery, pharmacy, medical appointments, etc. And then, family members who are at a higher risk to run essential errands, or who are not at a higher risk to run essential errands. And then use transportation that minimize close contact with others, such as biking, walking, driving alone. Keep people at higher risk separated from anyone who is in another room. And then social distance and maintain 6 feet. If possible, if you can wear a mask when interacting with those in your household, that would be, recommended as well. But obviously, it's not always, practiced, right? And then if sharing a room with someone who is sick, make sure the room has good air conditioning, put a physical divider, and disinfect frequently. And also, vulnerable or at-risk family members should not care for someone who is sick. And if possible, have only one person in the household take care of the person who is sick. And that person should not be at a higher risk for severe illness. And then also it is important to identify different caregiver for other members of the household who require help with cleaning, bathing, and other tasks. And then next, we'll talk about face mask, right? So we hear and see a lot of people wearing face masks. And so, how do we choose a type of face mask that can properly prevent and protect ourselves from COVID-19? And so, choose a face mask that have 2 or more layers of washable and breathable fabric. Face masks should completely cover your nose and mouth. And then they should also fit snugly against the sides of your face, and they shouldn't have gaps. Right? Masks prevent respiratory droplets from traveling into the air and onto other people when other person wearing a mask coughs, sneezes, or talk. It has clinically shown that masks have been very effective, right? And they have been to reduce the spray of droplets when worn over the nose and mouth properly. Also, the CDC recommends wearing face masks in public settings and while being around people who don't live in the same household as you, especially when social distancing. And, with social distancing and wearing a mask, you can save lives and properly protect yourself and others. And so again, with the infographic, I like to show pictures. And so this infographic does a really good job at, showing how to properly wear a mask and what type of mask should be worn. And so, remember to choose masks that have 2 or more layers of washable, breathable fabric. Masks should completely cover your nose and mouth and fit snugly against the sides of your face and shouldn't have gaps. It's also important to look out for masks that, aren't recommended. So for example, fabric masks that makes it hard to breathe, like vinyl, and then also masks that have like little valves on the end, because I know I see a lot of people in public wearing those, but technically the CDC doesn't recommend it because your droplets can actually travel through that valve. And so it just makes the mask pretty much ineffective. So that's not recommended. And then also N95 are usually worn by essential workers who are dealing with like COVID patients, right? So healthcare workers. And then also another thing to note is that, how to properly wash your mask and how to care for it. So masks should be washed regularly and always wash your hands after touching your mask, after using it. This include, just include your mask with your regular laundry, use regular laundry detergent in the warmest appropriate water setting for the cloth used while making the mask. So whatever your whatever your mask is made of, make sure that you wash appropriately with that fabric, if that makes sense. And so, with the holidays approaching, Thanksgiving next week, and then Christmas not too long after, and then holidays, the end of 2020 is nearing. And so a lot of us are planning to possibly attend or host gatherings for the holidays, even though it's not recommended this year to, host gathering. I know a lot of folks in the community, including myself, are very communal people. So we value connection and we value, being connected and being in community with other people. And so, if you are planning to attend and host gatherings, these are the recommendations that you should follow to keep yourself and other people safe. So for example, right, so have a small outdoor meal with family and friends who live in your community. Make sure to limit the number of guests and have conversations with guests ahead of time to set expectations for celebrating together. Because oftentimes, like, people have different expectations of like safety, right? So certain people have certain safety and comfort level when it comes to exposing themselves to social setting. And so it's important to have that type of conversation. And then also to remember to clean and disinfect frequently, touch surfaces and items, like I mentioned before, phones, doorknobs, table surfaces. And then if indoors, make sure to open windows, but it is recommended that if you host gatherings, it's better to host it outside. And then also have guests bring their own food and drink. And then if sharing food, remember to use single-use option utensils, even though it's not environmentally friendly, but it is safe. And so these are the CDC recommendation for hosting and attending holidays gathering in a really safe way. And, with everything that's going on, 2020 there's a lot of things that is going on. And so with the holidays approaching as well, and then dealing on top of that COVID-19, the current pandemic, being afraid and just feeling stressed out is very natural, especially with quarantining and not being able to physically be with people can take a toll on us emotionally and mentally. So it's important to be aware of our mental health and to take good care of it, and to be aware of how the stress is taking a toll on us and how it's affecting us, right? So stress during pandemic can sometimes cause the following: fear and worry about your own health and health of loved ones, your financial situation or job. A lot of folks have lost their jobs and income, or loss of support of services, right? Changes in sleep or eating patterns is another, way that stress can, show up in your life. Difficulty sleeping or concentrating, worsening of chronic and mental health conditions, increased use of tobacco and alcohol. So these are just some of the ways that, again, like I said, stress can show up in your life during this time. So it's important to be aware of how you're using this as a way to cope with everything that's going on. And so, I want to talk and specifically with, the demographic that Alzheimer's OC serve, right? So caregivers and patients with dementia and Alzheimer's. And so how do you manage stress as a caregiver? And so, these are some important, tips to keep in mind, right? It is a very stressful time, and I can imagine even more stressful if you are in charge of taking care of someone, like your loved ones. And so, it's important to maintain regular routine and healthy lifestyle. This will provide structure and a set of schedule. So that way, you have some sort of a structure in your day. And then improve sleep, right? More sleep, we boost our immune system, and so that we can be healthy and we can take care of our loved ones and others. Also, focus on what you can control. So like washing your hands, social distancing when going out, wearing face masks, disinfecting. So things that you can do to protect yourself and others, I think you should really focus on that as a way to cope and manage stress. And then also, most importantly, right, like create a care plan in case you do get sick. And so being prepared is part of taking control. And so knowing what to do if you do get sick and how will your loved ones or the person that you are caring for will be taken care of. I think that will help just ease your mind. And so that's really important to take note of as well. And then, take mini breaks throughout the day, right? So call a friend, stay hydrated, go on walks, watch something that makes you laugh, just do something that makes you happy. I think is really important and should be prioritized. And also, last but not least, right, be easy on yourself. I think with 2020 and the current pandemic, there's a lot going on, and everyone is dealing with something on top of COVID-19. So, these are very unprecedented times, but you are not alone, and we're all going through this pandemic together. So, just looking and going into caregiver support groups like what you all have been doing and what Alzheimer's OC offers, I think it's really important to take, those kind of resources and use it as a way to cope during this time and cope in a healthy way as well. And so, this is a very important question, right? So what do I do if I have COVID-19? I feel like there's a lot of misinformation, especially around the community about, what you should do if you contracted COVID-19. And so here is, a pretty straightforward, simple guideline on, steps that you should be taking if you ever are sick, right? So first off, obviously stay at home, except to get medical care. Separate yourself from other people. And again, if you live in multi-generational household, that's going to be a little difficult, but it's very important that you separate yourself in a different room and really social distance and isolate. Also monitor your symptoms, right? Check your fever. Has your symptoms get worse? Have they gotten better? So it's important to keep that in check. Call your healthcare provider and follow their care instructions. That's really important. I feel like a lot of people don't do that. So it's important to call your doctor, let them know that you have symptoms, and they should be able to tell you and advise you and instruct you on what the next step should be, right? And if your symptoms keep persisting, it's also important to call your doctor before visiting, because a lot of doctors' offices are doing telehealth. And so you don't want to, if you feel like you have COVID or COVID-like symptoms, you don't want to show up at your doctor's office without notice and possibly infect other people. And so as a way to protect others, it's important that you call your doctors beforehand before coming to a doctor's office. And then obviously wear a face mask, cover coughs and sneezes, and wash your hands in clean surfaces often. And if your symptoms get worse and you feel like you can't breathe or your fever is going up, this is when you would call 911. And so testing information, there has been a lot of information in Orange County regarding testing information, and for a lot of our immigrant community as well. People don't know what that process is like, what they should do if they have COVID, and where should they get testing, and if it's free or not. And so it's really important to be informed and updated regarding testing resources and information. So if you have health insurance, you should be able to get a COVID test through your health insurance and healthcare provider. So call your doctor and inquire that you feel like you want to get a COVID testing. They should be able to provide that for you, and it should be covered under your health insurance. But if you do not have health insurance, there's plenty of options and plenty of resources to get COVID testing as well. And so these are the Orange County sites for COVID testing. There is more on the Orange County Public Health or Healthcare Agency's website, but I just listed these locations based on the demographic, and like just, like we have one in northern OC, Central, and then South County. And so these centers provide free of charge COVID testing. Just call them and inquire about what that process is look like. And then, like a really cool resources is the API Task Force. So they have been doing free mobile COVID testing throughout Orange County. If you click on and go onto that website, they actually have a calendar of different locations throughout Orange County that provide free COVID testing. So it's literally a mobile, like a car, and they actually provide COVID testing that will give you rapid results, I think 48 hours, and it's completely free. And if you don't have insurance, that's like it'll be covered as well. So I recommend going into the website and checking out the really cool resources that they have. And then if you have Medi-Cal, that should be covered like under Cal Optima in Orange County. So if you have Medi-Cal, call Cal Optima and they should be able to instruct you on how to get a free COVID testing. But if you don't do it through Cal Optima, you can also utilize the testing information and testing sites in Orange County that is listed on here as well. So these are COVID-19 community resources, right? So these are just really helpful websites that you can access online that will help you stay up to date with COVID resources and, just like information that I think would be really useful. And then obviously with UCI Coronavirus Response Center, we actually have a UCI COVID-19 response team, and we keep up to date with COVID cases, community resources, and testing. So I definitely would recommend checking out that resources, and then also Orange County Crisis Prevention Hotline. So if you're looking for mental health services, that would be a really great number to call. And they have different like languages that can assist you with whatever like mental resources that you need. For the CDC, they also have different languages, like aside from English as well. And then Orange County Healthcare Agency also has different languages as well. And then obviously, we are an academic hospital and we are a comprehensive cancer center. So, we always want to promote cancer screening and early detection and screening. And so with COVID-19, there has been a decrease in cancer screenings, right? Because folks are scared to go into a doctor's office and they're scared to be exposed, which is, very reasonable. And so we have seen a lot of decrease in cancer screening the past year since COVID-19 started. And so because of that, we're expected to see a rise in later stages cancer diagnosis within the next few years. And so we want to make sure that folks are still on top of their cancer screening game and just being empowered to take care of their health, because, COVID is happening, but, cancer and other chronic illnesses doesn't stop for anyone. And so it's important to keep that in mind and to remember to, get your checkups regularly, whether it's cancer screening or any other chronic illnesses that you may have. It's important to continue that even with the pandemic going on. And so, with cancer specifically, there's actually different screening options that you can do. So for cervical, breast, and colorectal cancer, there's actually screenings that you can do at home. So you can do it at the comfort of your own home and don't have to go to the doctors to get these types of services. And then obviously screening needs to be done safely. So it's important to call your doctor to ask them what are their safety measures and protocols in their office to make sure that you feel at ease when going to get your regular checkup and, get your screening and early detection. And that concludes my presentation. We'll open up for questions for Melissa or anyone who's in this call regarding this presentation or resources. I'm happy to answer.
Thank you so much. That was packed full of information. I think it's perfect timing, as unfortunately our COVID cases are rising right now in the community, and we're all just trying to do our best to stay safe. As far as Alzheimer's Orange County goes, we have lots of resources for caregivers as well during this time. You can visit our website at alzoc.org. You can call our helpline, 844-HELP-ALZ. And that's the best place to start. And you can be in touch with one of our helpline specialists, and they can guide you to community resources or other referrals as needed. Or if you just need someone to talk to as a caregiver, they're a wonderful resource. And so we always welcome you to reach out to us. I don't have any questions. I think you covered everything very well. Thank you for that testing site information. I think that was really valuable, as well as encouraging people to go get those regular screenings. I know that those have dropped off for sure. And I know that our local health centers are doing everything to make, the centers and the hospitals as safe as possible for people to continue those much needed visits. So we would definitely encourage people to continue with their preventative screenings and regular doctor's appointments. Yeah, any final words that you can think of adding? I think you covered it very well.
Thank you. Yeah, like if anyone has any questions regarding COVID and cancer screenings and early detection, this is my email. You can reach me there. But thank you so much again, Melissa, and thank you to Alzheimer's Orange County for giving me the opportunity to bring this resources to you all. And yeah.
Our pleasure. Anytime. Thank you.